So now we can hear you.
Good day from wherever you're listening to me. I'll be taking us through the physics of nuclear medicine. I'm a medical physicist from the University College Hospital, Ibadan. I hope you can all hear me. Hello.
Yes, we can hear you now.
So I'll be talking to you about the physics of nuclear medicine. It's a branch of medicine that uses physics a great deal, and it has its important application in nuclear physics. Many of the great discoveries in atomic and nuclear physics have been used with great benefit in medicine. So there's a lot of application of physics in nuclear medicine. What is nuclear medicine? Nuclear medicine makes use of unsealed radioactive substances. These unsealed radioactive substances are open sources. They are not encapsulated. So, and they are referred to as radiopharmaceuticals in the sense that radiation is mixed with a drug. We have radiation plus pharmaceuticals. So the radiation has its inherent properties, while the pharmaceuticals or the drugs have their own properties. So they are used for the purpose of diagnosis and treatment of a range of diseases, including cancer. They're used to treat, and it's also used in treating cancer. Normally, nuclear medicine imaging modality is a functional imaging modality. So how are the radiopharmaceuticals used? They are injected intravenously or taken orally. So once the patient has taken up these radiopharmaceuticals, they are distributed throughout the body. So following their introduction into the body for diagnostic purposes, they are followed by external measurements or radiation detectors, whereby we could actually image the body and know the particular we know the particular organ to be imaged. So let's look at the basic constituents of atom. We all know that atom is the basic constituents of matter. It comprises of nucleus from our basic understanding of physics, and it's surrounded by electrons, negatively charged electrons. We have the understanding that it has the protons and the neutrons. So what makes an atom radioactive? We talked about using unsealed radioactive sources and radiopharmaceuticals, whereby we combine radiation and the drug. So the radiation is actually labeled with this drug. So what do we mean by an atom being radioactive? We have an unstable nucleus. For an atom to be radioactive, it has to be unstable in the sense that it has an unequal number of protons and neutrons. Either the neutrons is too much or the protons is too much. So in order to be, and it has a lot of excess energy. So in order to rid off this energy, it loses some of this energy in the form of radiation. It could be in the form of particulate radiation or electromagnetic radiation. So we briefly look at the different types of ionizing radiation. Normally, we use ionizing radiation in nuclear medicine because of the inherent properties that they have sufficient energy to actually cause ionization. But it's not all the types of radiation that we use. We go through that during the course of the lecture. We have the alpha particle, which has a high mass number. And as you can see from my screen, you could see that you have the basic knowledge of what an alpha particle is. It's an heavy element. An example is uranium-238, and this is an example of a nucleus that undergoes an alpha particle as its mass number decreased by 4, emission of an helium particle, while the atomic number reduces by 2. So for the beta minus particle, we have a nucleus that has too many neutrons, and with a bit to convert, with a bit to, it reads up in here, it converts the neutron to a proton as a result of the excess number of neutrons. So an example of a radionuclide or radiation, a radioactive element that undergoes beta minus is iodine 131. While that's of positron, we have another type of radioactive decay is with positron emission. An example of a radioactive element that undergoes with positron emission is fluorine 18. This is one of the radioisotopes we use in nuclear medicine for radionuclide imaging. So it has too many protons and converts it to neutron, whereby emitting a positively charged electron or a positron. We have the gamma radiation, which involves the emission of energy from an unstable nucleus in the form of electromagnetic radiation. Note, the electromagnetic radiation where we use in nuclear medicine is the gamma ray, because of the it has a long penetrating power. It could be easily imaged, and one of the radionuclide that emits this gamma radiation is technetium 99M. The M is a metastable. It's metastable life. It has a considerably lifetime. Like it could exist in matter for a period of time before it actually decays into technetium 99, thereby emitting gamma radiation. So the technetium 99M is the most widely used radionuclide in nuclear medicine for radionuclide imaging. It could be labeled with a variety of pharmaceuticals, depending on which organ to be imaged. Maybe the heart, the kidney, the bone. So we take a drug that has affinity for the bone. We could take a drug that has affinity for the bone or for the kidney and attach it to the technetium 99M. For instance, we have technetium 99M MDP. The MDP is the drug, while the technetium 99M is the radiation, making up the radiopharmaceutical. We also have the electron capture, whereby an orbital electron is captured by the nucleus and combines with a proton to form a neutron. So an example of a nucleus that undergoes electron capture is the ion 55. Let's look at the various types of production of these radionuclides. Where can we get these radionuclides from? We have the nuclear reactor, and examples of these radionuclides that are produced from the nuclear reactor includes the molybdenum 99. This is the parent radionuclide for the technetium 99M. So the technetium 99M is actually separated from the mother radionuclide, okay, which is the molybdenum 99. So we also have the cyclotron, whereby SPECT radioisotopes are produced. This includes the gallium, indium, as you can see from the slides. For the PET radioisotopes, let me make it clear that the SPECT radioisotopes emit gamma rays, okay? So we could actually image with a SPECT, single photon emission computed tomography system. So we'll talk about that in the course of the presentation. And we also have the positron emitting radionuclides, whereby the PET system, we could use this the PET system to image the radionuclides that emit positrons. An example of some of these radionuclides include the fluorine 18, carbon 11, oxygen 15, and nitrogen 13. So there's the system of the generator, whereby we have a parent-daughter generator. The parent-daughter generator, an example of the parent-daughter generator is the molybdenum 99, technetium 99M generator, whereby we're able to separate the daughter radionuclide. The daughter radionuclide is the technetium 99M, and while the mother radionuclide is the molybdenum 99. So we're able to separate it from the mother radionuclide through a chemical process. And one of these, as I said earlier, the technetium-99M is the most widely used radionuclide in nuclear medicine or radionuclide imaging. So we also have another example of the generator produced radionuclide, which is the germanium-68, gallium-68. Nuclear medicine has two objectives. So it's used for diagnostic purposes and therapeutic purposes. So it involves a situation whereby once the radionuclide has been administered, once it's injected into the body of a patient intravenously, or it's been swallowed by taken orally, maybe via the capsule. Okay, so we could actually after it has been administered, it involves the process whereby the patient is examined and evaluated. And of course, the records of the images of the activity distribution can be seen in the radiation detector. So for the purpose of diagnosis, and some of the applications involve organ function, nuclear medicine is a functional imaging modality as compared to radiographic images whereby anatomical information could be deduced. So you could actually know how well an organ is functioning through a nuclear medicine procedure. So examples of some of these functions include, you could determine the blood flow, the rate at which the blood is flowing in the brain, the rate at which the thyroid is taking up iodine, and many more functions. Other examples include bone scan, whereby you could detect bone tumors, the extent of metastasis. Lung scan, you could actually detect blood clots via a lung scan. And of course, in kidney, liver, or gallbladder, you could also determine or detect abnormal functions or blockages. So this is a typical example of a nuclear medicine scan, a bone scan, whereby you could actually depict the bone metastasis. You could actually detect some bone metastasis, indications for bone metastasis, arthritis, and even bone infections. Okay, from a bone scan. And a radiopharmaceutical that is used, yes, an example is technetium-99M MDP or HMDP. So we have the MDP is the drug that has affinity for the bone and is actually labeled with the technetium-99M that emits gamma rays. So nuclear medicine also has this therapeutic purpose, not only used for diagnostic purposes. So let's take a look at some of the procedures of a therapeutic procedure. First of all, we have the request for an examination. There's a prescribed dose, and the preparation is actually of the radiopharmaceutical is actually done by radiopharmacists. Nuclear medicine is an interdisciplinary field that consists of varying numbers of professionals. So we have, then once it has been prepared, is administered for treatment, and we have the patient follow-up. So let's look at one of the applications of these of a nuclear medicine scan. We have we use iodine 131, okay, for a thyroid scan. Once there's an indication for thyroid disease, hyperthyroidism, thyroid cancer, and the patient could be actually offered a nuclear medicine scan for the diagnosis and the treatment of the thyroid disease by swallowing up a capsule, a solid, a capsule of iodine 131, okay, and returning 24 hours later for the thyroid scan. The technetium-99M pertechnetate too could be used. The reactive could be used for the thyroid scan. Okay, so once it's been accumulated in the thyroid, we could obtain images of the thyroid few minutes later. So here is a typical illustration of what we can use nuclear medicine to do. So nuclear medicine can be used to image the hearts, the adrenals, the skeleton, the thyroid. The list is a bit headless. You can use to image the brain, and also detect the function or any detect any abnormalities that is inside any of these organs. In essence, this is a summary of what nuclear medicine is about. There's an indication for a problem, and we use an unsealed source of termed radiopharmaceutical. Once it has been injected or swallowed, is detected by slides. So let's talk about the instrumentation in nuclear medicine. I hope you can all hear me. So radiation detection is fundamental to the practice of nuclear medicine. The amount and the type of radiation administered to patients must be measured and documented. So these are made possible with radiation detecting instruments. Here's the list of the equipments or the detectors that are being used in nuclear medicine. We have the Dosa Calibrator, the survey meter, and the position. There are lots of so we'll be talking about some of these equipments. You'll be talking about some of these equipments and their functions. So we have the Dosa Calibrator, which is a very essential equipment in nuclear medicine. And it is used to measure the quantity of radioactive material in the prepared. Once the radiopharmaceutical has been prepared, you could actually measure the quantity, the activity in terms of Curie or becquerel. So depending on any radioactive substance you want to measure, it could be you could measure the iodine 131. You could measure the technetium 99M. Any radioactive substance could be measured with the Dosa Calibrator. And this is actually done in order to minimize, to prevent overdosing or to avoid underdosing. So this is done before being, this is actually done, the radiopharmaceutical is actually measured before being administered to the patient. I hope you can all hear me. So this is a typical illustration of the Dosa Calibrator, and it's cylindrical shaped, and it's gas filled. It has its various components, as you can see, and it's actually reads the activity in becquerel. It could either be megabecquerel or gigabecquerel. So let's look at another instrument that is used in nuclear medicine. We have the survey meter, the portable radiation detector. It's handheld and is used to monitor radiation levels for the purpose of radiation protection. So you could actually detect the level of radiation in an area, be it natural or in artificial radioactivity. But we use artificial radioactivity in nuclear medicine. We do not use natural radioactivity. This is due to the fact that the natural radioactivity has a very long lifetime, and it doesn't have the inherent properties that we need in radionuclide imaging. So it measures in exposure rates of milliröntgen, and the range in 0.1 to 50. We have the well counter as well, which is used to count blood and urine samples, and it will identify radioactive contamination existence in the surveyed area. So we have the gamma camera as well. My time is running, so I'll just skip through. We'll still get the presentation after. So we have the gamma camera, which is the most widely used equipment in nuclear medicine, and is used to image the radionuclide distribution in the patients. So this is a typical example of how the gamma camera looks like. We have the specs too, which records the gamma ray emissions from different angles around the patient. And the applications for this is in brain imaging, cardiac image. We actually use it to measure, to image the brain, and also, of course, the heart, and to detect abnormalities in any of these organs. We also have the PETs, which is whereby we use a positron emitting radionuclide for the diagnosis, when we use a PET scanner. So applications for this, we have the brain function, tumor is used in brain function and tumor detection. So the personnel dosimeter, that has been treated by the previous speakers. I'll just quickly run through. So the radiation has its effects, as we've been, as the previous speakers have talked about. So, and we need to actually take note of this. So what is medical physics? Medical physics has to do with the application of physics, and is pursued by medical physicists. We use physics principles, the methods, the techniques, and in a clinical environment, in research for the purpose of preventing diseases, for the purpose of diagnosis and treatments of human diseases, and with an overall goal of human health and well-being. So a medical physicist is defined as a health professional with specialist education and training in the concepts and techniques of applying physics. We apply physics in medicine. Of course, the medical physicist should be competent enough to practice independently in any of the subfields, be it radiation therapy, radiation oncology, radiology, or nuclear medicine. So a nuclear medicine physicist works in a nuclear medicine, the name of a medical physicist that works in a nuclear medicine department is a nuclear medicine physicist. And let's look at the roles of a medical physicist in general. We have, you can see we have the dosimetry, image and optimization, radiation safety. For the education and training of a medical physicist, it involves a university degree in physics, engineering, or physical science, though we have for the different countries have their requirements, minimum requirements for this. So we have an appropriate academic qualification at the postgraduate level, be MSc and PhD. And for one to be qualified as a clinically qualified medical physicist, it has to be well structured and supervised under a clinical training, and that has to be undertaken in an hospital. Thank you. Do we have a question?
All right, thank you very much, Ma, for the lecture. That was a very good presentation. If you have questions, please, you can drop them in the comments